The doors are locked, the clinic is dark, and the day is officially over, but you still have to log back on. Patients are texting, emailing, and messaging the portal with late-night questions about labs and refills. Spending 2 to 3 hours every night managing these queries creates a clinical trap. It consumes your personal time and limits the number of patients you can safely manage because your bandwidth is capped by administrative catch-up. Many practitioners try to solve this with a basic AI chatbot. However, standard generative AI is limited to writing text. It lacks the capability to access your internal records or execute the multi-step tasks required to resolve a medical request. This diagram illustrates the difference. On the left is standard AI, an isolated text bubble. On the right is agentic AI. This functions as a digital employee that performs tasks by retrieving data and updating your clinic's existing systems while you are in the exam room. In the next 5 minutes, we are going to knob out how to build an autonomous triage agent for your practice. Automating this specific workflow begins the process of reclaiming your clinical bandwidth, shifting hours of manual administrative labor onto the machine. This blank automation canvas is the workspace where we will construct the visual blueprint of your AI agent. Step 1 is setting up the initial automation node. This trigger tells the system to monitor and intercept incoming patient messages from your various portals. We configure this node with a time-based condition, so it only activates for messages received after your clinic has closed for the day. Step 2 is connecting your clinic's electronic health record, or EHR, to the automation workflow. An API creates a secure link, searching your EHR database via sender ID. This retrieves specific clinical context, like current medications and lab results needed to safely handle inquiries. By connecting the API, the agent operates using actual medical history rather than guessing. You should run a sandbox test at this stage to confirm EHR data correctly populates within the automation builder before moving to the next node. It is vital to maintain the after-hours filter we set in Step 1. This prevents the AI from attempting to respond to patients while your staff is already managing them during office hours. Connecting the communication portal to the EHR API allows the system to ground its responses in the patient's actual medical history. Now that the agent can retrieve the patient's data, we must define the rules it uses to interpret that information. Step 3 involves uploading your clinic's specific operational and medical protocols directly into the agent's logic core. This system prompt window is where you provide instructions. The agent will cross-reference the patient's EHR data against these rules to determine the appropriate response. You can then test several scenarios to ensure the drafts produced match your clinic's medical standards and professional tone of voice. To maintain safety, the AI should never be allowed to send medical advice or instructions directly to a patient without oversight. Step 4 solves this by routing every drafted response into a holding queue. The automation stops here and waits for your input. This creates a system of exception management. As shown in the diagram, the AI handles the bulk processing of organizing data, leaving only the final decision for you to review. Your morning routine changes from hours of data entry to a brief session where you review and approve these pre-written drafts. This human-in-the-loop requirement is a clinical and legal necessity to ensure you maintain total control over patient care. An approval queue allows the practice to operate at much higher speeds without sacrificing your medical judgment. This is the completed blueprint for an autonomous triage agent. It unifies your incoming messages, your EHR data, and your clinical logic into a single executing system. By implementing this, you resolve after-hours administrative leakage. You are no longer spending nights manually navigating EHR clicks to answer routine questions. You reclaim your personal time while providing patients with faster acknowledgments of their requests. This triage workflow is the foundation of an automated clinic. The next step is applying these same principles to patient acquisition. In the next video, we will show you how to build a 24/7 enrollment agent that qualifies leads and books consultations automatically.